Hi, my name is Donnie. I'm an ICU nurse at Gateway Regional Hospital. The purpose of my presentation was more or less just to put some information out there. Um, I did my practicum site at my place of employment at Gateway Regional Medical Center. I started out my nursing career on the cardiac floor and then later moved to the ICU. But I remember when I worked on the cardiac floor, there was always a staffing issue of some kind. We were either understaffed and we were always met with resistance from management. There was always some excuses to why we were staffed the way we were, or we'd get the typical "we're working on it" kind of answer. So the purpose of my project was just to provide information about staffing, about nurse burnout, about patient safety when there's not enough staffing present. Um, I did my presentation in front of a lot of my coworkers and my preceptor, Dan Rojak, who's the assistant CNO of the hospital. Um, the reason why this information was relevant, and I think we all can relate this, anyone who's worked in a hospital, and when you're understaffed and you're trying to get everything done and you have so many patients that there's just not enough time in the day. Something happens with one of your patients and the first question is, where were you? And most of the time it was, hey, I was taking care of the other 5 patients that I had. Or a doctor comes and asks you a question and it's really hard to give them an answer or come up right off the spot because, hey, I'm sorry, I've had 6 patients all day. I discharged 3. I got 2 new admissions. I haven't laid eyes on this patient as quickly as you're coming to ask me these questions. Um, so I wanted to make sure that I put hard facts about nurse burnout, what it does, and how nurse burnout greatly affects new graduates. New graduates come in and they say that if they don't make it within the first year, then they usually quit and look for a different career. And a lot of the time that has to do with the place that they work with. The staffing wasn't adequate enough. They're overworked, they're stressed out, and they eventually just get burned out and don't want to do it anymore. All their defense and coping mechanisms break down and eventually they just kind of withdraw. Um, the the best plans that I've seen, most of them are hospitals that stick to specific ratios or have scheduling uh, rewards, or they make sure that when they're doing their scheduling, you can choose the schedule that you want. So at least you made it so you can plan accordingly. You can spread your days out if you are a type of nurse that needs uh, multiple days off, so you work 3 in a row, or you separate it, maybe work 1 day, off a couple, work 2, off a couple, etc. The biggest thing that I found, and I wasn't even aware of this, was the mandated nurse to staffing ratio that some states already employ. California is kind of the front runner, the spearhead of this. They have specific ratios that they must oblige by when it comes to acuity of patients, which, in my opinion, acuity should base staffing and not just number of patients. For example, ICU nurses in California can only take 2 patients. Telemetry floor nurses can only take 5, I believe it is, and med-surg nurses can only take 6. OB nurses are 2. There's very specific parameters that they have to adhere to. And most of those nurses that are under these mandated scheduling or nurse to staff, nurse to patient ratios report less stress, less burnout. They're getting more sleep. Um, their patients are safer. With poor staffing, you run into more hospital acquired infections such as catheter infections and post-surgical infections. Um, I think the group or the that this really hits to is just all nurses in general, and I wanted to make sure that the assistant CNO was present, and I wanted to make sure that the other nurses were there and were aware of it, is nurses do a great job of advocating for their patients, but nurses don't do a good job of advocating for themselves. So maybe by presenting this information, maybe someone in the group realizes, hey, I can stand up for this and I can fight for this, and maybe that's something that we need to do. I know there's multiple organizations that lobby for this. Uh, your state agencies are a big proponent of lobbying for this, and hopefully eventually that leads to this, since there's going to be such a shortage of nurses in the future. They're saying up to 400,000 nurses short by the year 2030. So the AACN came up with a couple of different things that had about 4 topics that related to how to improve staffing, how to reduce nurse burnout, how to provide the best care for our nurses, and a lot of them were make sure that scheduling is well, make sure that we continue our education. It doesn't have to be an ASN going for their bachelor's. It can be education at the hospital that's done routinely. The ANC is a big proponent of having a residency program for new nurses to kind of bridge that gap from a new graduate into a well-rounded, experienced graduate. Instead of just throwing them into the fire right off the get-go, they go through a residency program, and these residency programs show that less first-year nurses are experiencing burnout, and more of them are actually staying. They're retaining their jobs, and the retention rate is better. They've also showed that when there's good staffing and there's great nurse-to-patient ratios, that more nurses will actually stay in the position that they're in instead of leaving after a year or two. They say that if the staffing is adequate, then there's less stress among the staff. They want to stay. And studies have suggested that if with better retention among your nurses, it actually reduces rehospitalizations, because nurses are more familiar with the community and the patients that come in. I did my presentation using a PowerPoint, and I'll put a copy of the PowerPoint on my Blackboard. It was a very enlightening experience. The practicum was really good too, because I got to see everything from the other side. I was in management for 10 or 12 years for the railroad, and management more or less is the same everywhere you go, but I was just kind of awestruck and kind of, I don't know, disappointed with the amount of red tape that there is in any hospital to try to get any policies changed. It was almost like there was committees for committees. The first 3 hours of every practicum day was just meeting after meeting, safety huddle, and then you see this pattern where people just they don't talk anymore, and then they'd be a committee about a subcommittee, and then it would, oh, we'll get back to you, before anything actually got changed. And it's not always the administrator's fault, the executive's fault. Sometimes it's just corporate policy. They have to bounce it off corporate. Corporate has to send it back and see if they approve it. So it brought some enlightenment in that regard, that when there's things that we want to change as nurses, we work on the floor, hey, this doesn't work, we need to do this. We have to be a little more patient. We still have to be diligent enough to ask, but a little more patient when we try to get things changed. Same with hiring new nurses. It does take time, but it's definitely an area that we continually have to ask about. They say that a new nurse, when they graduate, get trained, orient, hired, drug tests, and they are finally ready to work, it takes $40,000 to $60,000 to replace them if they leave. So hospitals should work more on retaining employees and making sure they have adequate staffing, because that's a money saver right there. And during all these meetings, the one thing you learn is the dollar is the bottom line. I have to be honest, and I mentioned it in one of my journals too. I knew when I went into nursing that I didn't want to be a manager anymore. I did it for 12 years. I didn't like it. I got burnt out. I was ready for a change. And there was no way that I would want to go to management. And this practicum reaffirmed that I feel like I have strong leadership skills, and I've been asked to take positions, but it's just not for me. I want to be a nurse practitioner. But overall, I enjoyed the experience. My preceptor was great. He was very flexible, uh, very informative. Um, we had a lot of common interests, so sometimes we would just kind of joke around and talk about other things too. Like nurses do, it doesn't always have to be about the topic at hand. Sometimes to lighten the mood or take some of the stressors off is to have those icebreakers and common ground that you can connect with people. I wouldn't change anything else about the practicum. It worked well in reaffirming my career goal, and it'll definitely help. There's a lot of things from the leadership books that we got that I'm now currently using about patience and how to be a good leader. I don't think we're ever done learning, and as soon as you're done learning, then it's time to retire. Um, but that's all I got. Thanks, guys. Congratulations, everyone, on graduating.